Ever experienced an upset stomach that seems to linger? Could it be gastritis? Gastritis, in simple terms, is an inflammation of the stomach lining. It's a common condition, yet often overlooked. But here's the catch. If left untreated, it can pave the way to more serious health issues. It's not just about the discomfort, it's about the potential risks that follow. So it's high time we pay attention to our gut feelings, literally. Understanding gastritis begins with knowing its symptoms. Let's delve into that next. Gastritis symptoms may vary among individuals, but some are more common than others. Let's delve into some of these common symptoms and understand what they might mean for you. Firstly, an upset stomach is frequently a telltale sign of gastritis. This can be a general feeling of discomfort in your stomach that just doesn't seem to go away. It may be accompanied by a burning sensation, especially between meals or during the night. Next up is nausea, a sensation of unease and discomfort in the upper stomach with an involuntary urge to vomit. Now, it's important to remember that nausea doesn't always lead to vomiting, but it can certainly make you feel quite unwell. Speaking of vomiting, this is another common symptom of gastritis. Vomiting can occur when the nausea becomes too intense, but it's also possible to experience gastritis-related vomiting without prior feelings of nausea. When associated with gastritis, vomit may contain blood or a substance that looks like coffee grounds. Another symptom that you might encounter is a feeling of fullness in the upper abdomen after eating. This can occur even after consuming a small amount of food. This feeling of fullness, known as early satiety, can lead to unintentional weight loss and malnutrition if not addressed. Now, these symptoms can present themselves in different ways. Gastritis can be acute, meaning the symptoms occur suddenly and severely. Imagine waking up one day with intense stomach discomfort. That's acute gastritis. On the other hand, gastritis can also be chronic, meaning the symptoms occur over a long period. In this case, the symptoms might be milder but more persistent. Imagine dealing with a constant, dull stomach ache for weeks on end. That's chronic gastritis. So, there you have it. The common symptoms of gastritis, from upset stomach and nausea to vomiting and a feeling of fullness after eating. Each of these symptoms can indicate a different severity of gastritis. Each symptom can indicate a different severity of gastritis. So how can you tell if you have gastritis? Not all stomach aches are gastritis. It's crucial to differentiate gastritis symptoms from other conditions. Gastritis, in simple terms, is the inflammation of the stomach lining. It can cause discomfort, but its symptoms are not always easy to distinguish from other conditions, such as acid reflux or stomach ulcers. So, how do we differentiate? Let's start with acid reflux, also known as gastroesophageal reflux disease or GERD. This condition is characterized by a burning sensation in the chest, often after meals, and is caused by stomach acid flowing back into your esophagus. However, gastritis might also cause a burning pain in the stomach, not the chest, and it doesn't necessarily follow meals. Stomach ulcers, on the other hand, are sores that develop in the stomach lining. They cause a distinct gnawing pain that might feel like hunger pangs. Gastritis can also cause stomach pain, but it's generally more of a dull ache rather than a sharp, gnawing sensation. Another symptom to look out for is nausea or vomiting. While these can be symptoms of both gastritis and stomach ulcers, they are not commonly associated with acid reflux. And then there's the matter of duration. Acid reflux symptoms tend to come and go, often related to specific triggers like certain foods or lying down after eating. Gastritis symptoms, however, can persist over a longer period. Stomach ulcers can be tricky, as they might cause intermittent pain that comes and goes for days or even weeks. Remember though, these are general guidelines. Symptoms can vary widely from person to person, and only a healthcare professional can make a definitive diagnosis. If you're experiencing persistent or severe symptoms, such as unexplained weight loss, persistent vomiting, or blood in your vomit or stools, it's crucial to seek medical attention. Gastritis, while common, should never be taken lightly. So let's be proactive about our health, understanding the symptoms, and seeking help when necessary. Let's revisit what we've learned about gastritis. This condition refers to inflammation, irritation, or erosion of the stomach lining, which can occur suddenly or gradually. It's a common health issue that, while often mild, can lead to serious complications if left untreated. Now, onto the symptoms. Gastritis often presents with upper abdominal pain or discomfort, nausea, and vomiting. Some might also experience a feeling of fullness in the upper abdomen after eating or an unexpected loss of appetite. However, it's important to note that these symptoms can vary greatly from person to person, and some may even have gastritis without any symptoms at all. The key here is to pay attention to your body. If you're feeling off, it's crucial to seek medical advice. You see, symptoms of gastritis can mimic those of other conditions. This is why distinguishing these symptoms is so important. It's not just about identifying gastritis, but ruling out other potential health issues like peptic ulcers or gallstones. In a nutshell, understanding gastritis means understanding your body. It's about recognizing the signs and symptoms, knowing when to seek medical attention, and understanding that these symptoms can indicate other conditions. Remember, when it comes to health, knowledge is power. Stay aware, stay healthy. Before we wrap up, remember that gastritis is manageable. It's important to understand that this condition, while common, is not something to ignore or bypass. Gastritis can be more than simple discomfort. If left unchecked, it can lead to serious complications. Your health is not something to gamble with. If you suspect you may be experiencing the symptoms we've discussed today, don't hesitate to seek medical advice. Doctors, nurses, and other healthcare professionals are there to help you navigate these issues. They can provide you with the right treatment plan and guide you towards the path of recovery. Your stomach health plays a vital role in your overall well-being. Taking care of it should be a priority. Stay informed about the conditions that can affect it, like gastritis. Knowledge is power, and in this case, it can be the key to a healthier, happier you. Remember, a healthy stomach is a happy one. Stay informed and take care of your health.